Cervical dizziness without neck pain. Is that possible? I'm going to talk to you today about why this goes undetected. Why is no one identifying or acknowledging neck problems causing your dizziness or vertigo? Why is this remaining undetected if you don't complain of neck pain? I'm going to go over that today. But first, just a reminder, I'm Dr. Kim Bell. I'm a doctor of physical therapy in San Diego, California. I am the vertigo detective, and this video exists to offer information, education, and hope to people who are trying to recover from dizziness or vertigo from anywhere in the world, but this is not individual medical advice for your case. Today, we're going to talk about why most healthcare providers won't even consider your neck as a possible cause of dizziness or vertigo if you don't complain of neck pain. Some doctors may even tell you it cannot be possible that your neck may cause dizziness or vertigo. I've certainly seen plenty of patients whose doctors have told them there's no way this dizziness is from your neck. What if your neck has tension or stiffness but doesn't have any pain? Can tension or stiffness cause dizziness or vertigo from the neck, even if you don't have pain? These are all the points and questions we're going to address today. So let's get into it. And make sure you stay until the end so I can show you the favorite tool that I recommend to my patients to use at home for dizziness or vertigo from their neck. What I did here is I opened up my internet browser and I just typed into Google something that you can type easily if you want to research this on your own. All I typed here was cervicogenic dizziness diagnostic criteria. Okay, cervicogenic dizziness is the technical term for dizziness or vertigo from your neck. So if you can type this into your browser, you probably will come up with very similar results as I did. Let's take a look at this. I want to make a point about why this condition is undetected in so many patients with neck tension or stiffness. Okay, so first of all, cervicogenic dizziness as a diagnosis is considered what's called a diagnosis of exclusion. Okay, so what does this mean? This means it's diagnosed by ruling out other conditions that can cause similar symptoms. So therefore, if you have another diagnosis at the same time, they won't even consider your neck. That doesn't make sense to me. I'm sorry. That just doesn't make sense to me. Why can't two things be true at the same time? Why can't you have migraines or vestibular migraines and cervicogenic dizziness? Why can't you have BPPV and cervicogenic dizziness, which I find in many, many of my patients? Why can't you have some kind of neurological condition and cervicogenic dizziness? So to me, fundamentally, I disagree with this diagnostic criteria. And that's part of why my method is different than what you would call textbook traditional healthcare. I know what they're teaching and I know what the textbook says, but I see so many patients who have fallen through the cracks with the traditional healthcare system that my method and my practice goes well beyond that into the idea, something like this, which you might say is a radical idea when you're considering the textbook, but to me, it's just common sense. Someone can have cervical dizziness and also have another cause of dizziness or vertigo at the same time. Okay, that's the first key point. Now, here's the second key point with how this is diagnosed, and I don't want you to miss this. Look at this. What is the diagnostic criteria for cervicogenic dizziness? The patient should have a history of neck pathology. Well, to me, this is a problem because now that patients are spending so much time on their smartphone, their tablet, their Kindle, their computer, people are spending so much time on these devices hunched over in these postures, and those postures can cause a gradual onset of tension in the neck or stiffness in the neck, and therefore cause a gradual onset of dizziness or vertigo over time, over a period of months or years, okay? So to me, I see a lot of patients with cervicogenic dizziness. We're talking about dizziness or vertigo from the neck, and they don't have a history of neck pathology. That means their neck looks pretty good, but it's their habits, okay? It's their computer use, it's their phone use. Maybe they have a hobby where they do a lot of hunching forward. Maybe they play a musical instrument where they tilt their head to the side a lot, things like that. They have an occupation where they have to round their body forward all day or tilt their head to the side all day. So these are things that are risk factors for cervicogenic dizziness that don't have anything to do with a neck pathology. Yeah, maybe those patients would also develop a neck pathology because of these risk factors, but I see many, many patients who don't have a neck pathology. So to me, that doesn't need to be a limiting diagnostic criteria, but it currently is. Now, third key point here, and this is why it goes undetected in so many patients. Look what they say. Cervicogenic dizziness should not even be considered if the patient does not have neck pain. Boom, there it is, you guys. So if you're not complaining of neck pain, your clinician is not even going to be thinking about cervicogenic dizziness. If you don't have a history of neck pathology, like I'm talking herniated discs, pinched nerves, whiplash, that kind of stuff, they're not going to be thinking cervicogenic. And if you have some other condition that also causes dizziness or vertigo, then therefore they can't diagnose cervicogenic dizziness because it's a diagnosis of exclusion when everything else has been ruled out. Okay, so for those three reasons, I think this is going undetected in so many cases. So now I want to show you an article I wrote on this on my blog, which if you go to vertigodetective.com, I talk about upper cervical dizziness. And look, when I was a novice clinician and I was first starting out in this, and the only reference I had was the textbook, I made those same errors with my patients. I wouldn't consider the neck if they didn't have any pathology, if they didn't have any pain in their neck, and if they had something else that could contribute to dizziness or vertigo. So I was in that same boat when I was a younger clinician, a beginner clinician, but I've learned through experience that patients can have dizziness or vertigo from their neck due to tension or stiffness if they cannot move their head and like touch their chin down to their shoulder like that, okay? If they can't do that, then they have limited mobility in their neck, and that can cause a constant lightheaded feeling for some patients, and it can cause vertigo attacks for some patients, okay? So let's take a look at this. I wrote this article to help you kind of try to see, is this me? Okay, so again, the upper cervical dizziness, how is this going to present? You may feel like you have a fairly constant lightheadedness. It usually gets worse in the evening. Okay, upper cervical alignment problems are typically in the C1 atlas bone. That's the first bone of the spinal column right under your skull. And then the C2 axis bone. That's the second bone of the spinal column. So when we look at the head, which is the skull, the top bone of the spinal column is the C1 atlas. The second bone below that is the C2 axis. If those are shifted out of place, tilted, slid, rotated, they're not moving properly, they're stuck somewhere, they can cause dizziness, lightheadedness, vertigo attacks, and imbalance. Sometimes they also cause ringing in the ears that waxes and wanes intermittently throughout the day, and they can cause the headaches. These type of headaches are going to be kind of up here on the sides of your head or the top of your head, maybe right on your forehead there, and they're going to feel, for some patients, it feels like a swim cap is like squeezing your head, like you're wearing a bathing cap, a swimming cap, and it's just squeezing your head. That's called a tension headache. And those can come, or a headache at the base of your skull. So in the back, behind your ear, between your ears, in the back, at the base of the skull, upper cervical dizziness can come with those headaches. So if you're thinking, yeah, you know, when I started having these problems with dizziness or vertigo, I did start getting these squeezing headaches or headaches on my forehead, headaches on the sides of my head, headaches back at the base of my skull. These are some symptoms that may give you a clue that maybe you have upper cervical dizziness that no one has assessed you for. If you have stiffness in your neck and you can't turn your head all the way 90 degrees to both sides or look up 75 to 90 degrees straight up, then you might have upper cervical dizziness. And again, we're not talking about neck pain. We're talking about other neurological symptoms and other indicators that you may have upper cervical dizziness. Okay, and then this just sort of goes through your noise. Your neck may make noises like a crunch, a click, a pop, or a grind when you turn your head to the side. Neck noises during active head turns may be a sign that vertigo or dizziness might be from your upper cervical area. Although some patients with upper cervical dizziness do not hear any noises in their neck when they turn side to side, they may still feel tension. Okay, so then here we go. Let's review common signs and symptoms that you might have upper cervical dizziness. And I'm going to show you that one tool that I use for all my patients with this problem. So don't go anywhere here. We're just going to run through this real quick. Common signs and symptoms. Dizziness never really goes away. Fairly constant, lightheaded, woozy, floaty. Gets worse sometimes. Most of the time it's in the evening. Or maybe like after working on the computer or after bending forward for a long time, like chopping vegetables or something like that. Tenderness or pain in the space right behind the earlobe. So like if you touch right behind your earlobes, right there in that little spot underneath your and behind your earlobe right there. Okay. If that's tender, and there's a photo of this at the top of the blog where she's pointing to that spot. Let me show you. I'm going to scroll up. If you don't like scrolling, close your eyes real quick. Okay, right there. So see, she's pointing to that spot. If you have tenderness in there or a little nausea or dizziness when you touch yourself behind the earlobe, then you probably potentially have your C1 bone is out of place. Okay. Next, people with upper cervical dizziness may have crunching, cracking, clicking, or grinding in their neck when they turn their head from side to side. They can't turn their head all the way from side to side, so they have limited mobility. Oh, this is interesting. Their dizziness may be relieved with the use of ibuprofen or nonsteroidal anti-inflammatories. I'm talking, this is like ibuprofen, Advil, Aleve, anything anti-inflammatory can actually, for some of these patients, not all of them, depending on what's wrong with their neck, but some of them, if it's just inflammation, they can get relief from dizziness with an anti-inflammatory medication. So I'm always listening when my patients tell me their history. If they say, yeah, you know, when I take Advil, my dizziness goes away. That's a clue that this is from their neck. Okay, they may have intermittent pressure or fullness in their ears. They may have intermittent ringing in their ears, tinnitus. Some patients even have pulsating dizziness in bed at night, which may change with different neck positions. Oh, you can have pulsating tinnitus too. So the ringing in your ears might take a pulsating quality. And so, but if you change the position of your neck, like you straighten up your neck, it may lessen, if not go away. Some patients with upper cervical dizziness get anxiety. Interestingly, when your C1 or C2 bone is out of alignment, it actually triggers your sympathetic nervous system. So it puts you in a state of like a fight or flight. It actually causes anxiety for some people. Isn't that wild? And so getting this corrected can calm down your nervous system, can help some people that have anxiety from their neck being out of alignment. And then they generally have neck tension. They may have those headaches I mentioned in the different locations, top of the head, sides of the head, forehead, base of the skull, headaches. And then they may have recurrent vertigo attacks. These recurrent vertigo attacks can last for seconds, minutes, hours, or days. So here's some more information about that you can check out. But what I want to show you as we wrap up here is the store on vertigodetective.com. If you go to my store here, and this top section, what does it say? Most often recommended to patients. So here is the secret weapon that I recommend to my patients with this problem. The neck ice pack wrap. That right there, I tell all my patients with dizziness from their neck that they should ice their neck every night, or if they have a flare-up at all during the day, for 15 to 20 minutes with this ice pack. And this is part of their recovery until their dizziness or vertigo from their neck is resolved. If the dizziness or vertigo from their neck ever recurs, they can start using the ice pack again, but I encourage them to seek out specialized healthcare to resolve this problem. And if you want to learn about who can help you with upper cervical dizziness, check out this video right here. Okay, I hope you have a great day and God bless you all.